All right, Dr. Pakman, let's talk about teeth brushing. Electrical brush, hard brush, soft brush, the lengths of brushing, and maybe a little bit of flossing, different flosses. There's so many staff out there. Is there a difference on all of it? Do we need to pay attention to it?
There is a difference. Yeah, there are differences between individual brushes and, of course, differences between mechanical brushes and the electric brushes. But the key to all of toothbrushing is to, number one, it has to be done properly. We describe a circular scrubbing motion rather than going straight up and down or back and forth this way. And the thing that the electric toothbrushes are very good at is they have timers inside them. And they sort of force you to brush your teeth for 2 minutes. We advise people...
You get electric shocked if you put it away?
Yeah, it shocks you. But they have built-in timers, and they're very good because they actually make you brush your teeth for 2 minutes. If you brush your teeth for 2 minutes with a mechanical brush, you get the same effect that you would with the electric brush. As far as floss goes, I advise my patients to use whatever floss is comfortable and can slip in between their teeth. You know, they have floss that's as thick as a rope and some that's like a monofilament that you can't see. You want to find a floss that works for you, and flosses are different for each person. So.
Okay. And what about the softness of the toothbrush? Hard, tough,
Must
soft?
be soft.
Soft.
Must be soft. No mediums, no hard, soft. Now, a lot of the major manufacturers do make soft brushes. So, and that's something, when you go to a drugstore, you're going to buy it. I dispense them to my patients, and all the brushes that I dispense are soft, bristled brushes. So that's one thing that's very important for people when they buy a brush, to get a soft brush.
I got it.
It minimizes the damage to the soft tissue and to the teeth.
Okay. Now, what's more important to brush, the teeth, the actual enamel, or the gums, or both, or in between? What should we pay attention to?
Well, basically what we're trying to do with a toothbrush and floss is to remove the plaque from the teeth, that sticky bacterial thing that forms on our teeth every 24 to 48 hours. So you really should concentrate on the teeth themselves. But if you have a soft enough brush, you're also going to be stimulating the gum to get good blood flow and to clean anything off the gums themselves.
I see.
Floss is very important because it gets in between the teeth, where you can't get with a brush.
And when we floss, we pay attention to floss up on the gum and massage it, or like on the side, or both?
Well, we bring it down the side of the tooth or up the side of the tooth that's in the top, and in a gently sawing motion against the tooth, that's what we're doing to break up the plaque. And then we just pull it out.
Okay.
And I advise people to floss first and then brush.
All right. Now, I've lived in India for a couple of years, and just about everybody there uses a tongue brush, a tongue cleaner. They have a, it's like a little fork thing, and it has a scraper. It's a tongue scraper. It's like a snow shovel.
Right.
And I see this very little around here. Is there a value to cleaning and brushing or scraping your tongue?
Yes, I advise all of my patients to brush their tongue with their toothbrush. You can use a tongue scraper. You got to be careful not to damage anything, but a toothbrush is fine to brush your tongue. And the reason we want people to brush their tongue is the back of the tongue can harbor a lot of bacteria because of the taste buds and the lymph glands that are back there. So we always ask people to brush their tongues. It's also one of the leading causes of bad breath.
I see.
Not brushing your tongue.
I see. Good. Well, that's good to know. That's good to know. Are there any other causes of bad breath rather than, some people, they do, everything is fine. They just came out of a dentist. Everything is basically fine, and yet there's still bad breath. Does that also have to do still with teeth, or is there other aspects involved?
Well, most of the causes of halitosis or bad breath are dental related, and they're bacteria related. So if we're not cleaning all the bacteria off, we're going to get bad breath. However, there are some medical conditions mostly gastric conditions, that can cause a bad odor coming from our breath. So sometimes we may have to advise a patient to get a medical evaluation to rule out any of those systemic problems that could cause bad breath.
Okay. Well, first go brush, clean your teeth, do your thing, clean your tongue, do all that stuff, and
Yes.
it usually should take care of it.
Yes.
Well, thanks a lot.